I'm gonna present these questions or like Jeopardy style. And Dr. Fang is gonna help me keep track of like the points, as well as what a category and link has been selected already. You guys could just in the chat, like raise your hand as like a buzz in and then give your answer. And we'll try to keep track as best as we can. Before I get into this, so my name is Ala Elmoed. I'm a PGY5 now, R4, at Loyola University. I'm from the University of New Mexico, is where I did my training. And I am excited to move on. I'll be doing MSK at the University of Washington in Seattle. And then I'll let Melissa, Dr. Fang, introduce herself.
Hi, everybody. I'm Melissa Fang. I am an R1 at Loyola, and I also happen to be from the University of New Mexico, but unfortunately, Ala and I had just missed each other while we were going through. That's also where I did my preliminary year in internal medicine, and now I'm 4 months into R1 and loving it a lot.
All right. I can't see the chat. I don't, oh, here we go. Sorry. It's been a while since I've used this. I also did my PGY1 in surgery. So if any of you guys have any questions, you guys could contact me about that. I recommend surgery for everyone, but that's my bias. All right. So Melissa, you could see my screen, right?
Yes, I can.
All right. So we'll go ahead and get started. Jeopardy. And yeah, I like Lost Cruises too, but I'm from Albuquerque, so technically I hate you guys over there. Anyways, what was I gonna say? This is, very laid back. Don't be shy. If you get a wrong answer, it's okay. We're all gonna get wrong answers. And if you get a right answer, great. You're probably smarter than me, believe it or not. So let's just get to this. Wait a second, how do I? Are you guys still seeing my screen?
No, at this point, it's gone dark.
Yeah, it's like struggling, I guess.
We can see your screen.
Just not the PowerPoint. Here, let's try.
You're on the PowerPoint, but not in presentation mode right now.
I'll click on slideshow.
All right, how about now?
Yeah.
There we go. Looks good.
All right, there we go. All right, so we'll start off by anyone could just name out, the first person to name out the category and number first. We'll go with that, and then whoever gets the right answer can select the next category and number. All right, rest of your innards for 200. Let's get there. Okay, so fecalization of bowel loops may be seen in this condition. Small bowel obstruction, correct. Mir Ali Mazhar, you're correct. So what we're seeing here is we see fecalization, and this is actually in the small bowel. You shouldn't see fecalization like this in the small bowel. And so when you see that much stool in the small bowel, you want to think that there is potentially there is a small bowel obstruction. All right. All right, Mr. Mir, how about you choose the next question? Okay, rest of innards for 300. I'm not going to read the questions for you guys. Sale sign. All right, exactly. So what we're seeing here is, so this is a lateral view of an X-ray of the elbow, and the soft tissues are this gray area. So you have muscle and then subcutaneous tissue, and then you have this lower density area right here and right here, and this represents fat, and you should never really see this posterior fat pad in this area, and when it's raised, that means that there's an effusion and probably a fracture. So we call it the sale sign. And sorry, I forgot the other part of the question is it's a radial fracture. All right. All right, Mir, how about you choose the next question again? Okay, I'll read the questions out loud. So getting on my nerves for 100. This can be present with a calvarial fracture and can be either arterial or venous. All right, so this is going to be an epidural hematoma. Mr. Mazhar, you're on a roll here. So yeah, what we were seeing was that large epidural hematoma. Most often, the most worrisome.
Ollie, on my screen, it actually looks like somebody else buzzed in before.
Yeah, I
Oh.
think Hari answered first.
Oh, did he? Oh, he did. You're right. Thank you. Thank you for picking it. Okay.
I appreciate the sportsmanship.
Good job. Mr. Hari Lakshmana. I'm sorry if I'm butchering you guys' names, but yes, you are correct. All right, so I'll have you pick the next question.
Can we do past the 5 FR 100?
Pass a 5 French for 100, you said?
100, yeah.
All right. So this vascular implant shown below connects the portal venous system to the hepatic veins. Tips, correct. Okay, so we got Pizza Shaki, got it correct. And what we're seeing is this guy right here, and this is a TIPS, intrahepatic portal systemic shunt. All right, you want to choose the next one, Pizza? Okay, pass a 5 French for 200. This vascular anomaly is treated when afferent vessels measure greater than 3 millimeters. This one's kind of a hard question, I thought. Okay. So so what we're seeing is here, and I'll give it to you. It is a okay, yeah. So pulmonary AVM. Okay, I kind of went too quick. So I'm going to give it to Samantha because she was correct, more correct. It's a pulmonary AV malformation. So go ahead, Samantha, and choose the next question.
Can we do doing the heavy lifting around here for 100?
Sure. Degenerative disease characterized by joint space narrowing, sclerosis, and osteophytosis, and the pattern and distribution seen here. Osteoarthritis. All right, good job, Smriti. So what we're seeing is all this arthritic changes in both of these hands. And I'll let you go ahead and choose the next one. Next question, I mean. Oops. What did I do? Sorry guys, 1 second. I guess we're gonna do MSK for 200. All right, so white arrows point to this sign seen in the aggressive bony lesions. And no one's got it yet. Codman triangle, exactly, Mary, yay, you got it. And sorry, Samantha, I think not Samantha, Smriti, I chose a question for you, so I'm going to let Mary choose the next question. And this is Codman triangle. As you can see, there's some periosteal reaction of this elbow. or sorry, knee, and you could see like layering bone forming in this area, and this usually is seen in osteosarcoma. All right, Mary, you want to choose the next question? Getting on my nerves for 200. These are the names of these two structures. Kind of a two-part question. Well, it is a two-part question, but, or two questions, one answer, or two answers. All right. So two answers, guys. Okay. Caudate nucleus, okay. So this one's a little bit hard. So it's pointing to two different structures, and it is the globus pallidus and the caudate head. So I'm gonna go ahead and give it to Louisa, because she did get the caudate head, but it was also pointing to the globus pallidus as well. All right, Louisa, you want to choose the next question? Getting on my nerves for 300. The red arrow points to a sign often seen in this condition. And it's pointing to this right there. All right. Dense MCA sign. Okay, that's a better answer. I'm sorry. Sorry, guys. So the answer is hyperdense MCA sign. So that little density over there was the middle cerebral artery, and that indicates a thrombus. And then the second picture was showing the infarct that was just distal to it. So good job, Joey. Which question do you want to go for? Next generation 500. Okay. Here we go, guys. This sign is seen in infants and represents dilatation of the proximal duodenum and stomach. Double bubble sign. All right. Good job, Mir. You're on top of it again. So double bubble sign, it's seen in duodenal atresia. All right. Next question. There's, it's funny. You guys are all really quick typers. There's like board review sessions that we do sometimes across the country, and like you're competing with hundreds of people, and it's insane how fast people think and type sometimes. But you guys are doing really well. All right, Mira, do you want to choose the next question?
What do we have left from the rest of the innards category?
Yeah, sorry about that, guys. The link color is not changing, but Melissa's.
We have 100, 400, and 500.
Let's do 400.
All right. The innards 400. You said 400, right? Well, we're choosing 400. All right. This tree and bud pattern in the lungs suggests this pathology. All right, you guys are getting somewhere, but not quite. You guys are thinking zebras right now. Okay, still kind of zebras, guys. This is when you think tree and bud, an infection is something that you should think of. But that's, I don't know, Melissa, do you think that's a good answer?
I think we should take that one.
Okay, so the right answer is bronchiolitis, which is small airway disease. It's a lot of times related to infectious inflammatory etiology. So I'll give that to you. I have to scroll back up to see who said that. Ilili, good job. You could go ahead and choose the next question. Getting on my nerves for 400. Oops, wrong thing, sorry. These findings are often seen in what condition? All right. Good job, everyone. So MS, and just a follow-up question, does everyone know what they're called? Dawson's finger, exactly. So what we're seeing are these hyper-intense foci along the ventricles, and these are called Dawson fingers. And I think you learn them in med school. I feel like I never learned it in med school, but that's probably because I wasn't paying attention. But they're periventricular, perivenular areas of demyelination, and they're usually perpendicular to the lateral ventricles. So good job. And the first person to answer that was Shija. If you want to choose the next question, Shija.
Yeah, sure. I don't remember what's left, but can you just select the last category that still has a 100?
Oh,
That would be either next generation or innards.
I'll take next generation.
All right. This third fracture of its class courses along the growth plate and down the epiphysis. Okay. Salter-Harris fracture. Can you guys give me do you guys know the different types of Salter-Harris fractures? I'll give that to you. I feel like that's getting into the details, but there are details that you're going to need to know in radiology as well as in any field that you go into. So it is a Salter-Harris, and this is a fracture that we're seeing right here, type 3. Good job, guys. Okay, see, you guys are really smart. And this is a mnemonic that helped me remember it and then forget it and then remember it again and forget it again. But just remember Salter, straight across, above for the second type, lower, and so on and so forth. So still gonna give that to Mir, even though you guys got it more accurately, Trisha and Shiva, but Mir, go ahead and choose the next question.
What was the other 100 that was left?
The rest of it.
Innards.
Let's do that one.
Right. If this entity ruptures, patients may present to the ED with acute onset back pain or abdominal discomfort. You guys are too fast for me, which says a lot. If I'm this slow and I'm making it through radiology, then all the slow typers, you guys are going to be very successful as well, probably more successful than me. So yes, this is an abdominal aortic aneurysm, and Mir, you're on top of it. So go ahead and choose the next question, Mir.
What do we have 500 left in?
Oh, lots of things. We have the 5 French, the nerves, the lifting, and the innards.
Let's do the innards 500, please.
All right. This is a liver lesion seen below. You guys are getting somewhere, but not quite HCC. Hemangioma, good job. And you put it as a question too. Samantha, you got the answer correctly. So this is a lesion, and then we have no contrast in this one. Then we have contrast, and this is not quite the arterial phase, but somewhat the arterial phase, and we see some enhancement along the periphery that's not continuous, and it's nodular. All right, and that's a big key finding, is the nodular appearance. And then on more delayed enhanced imaging, you see that there isn't washout. So there's still some enhancement going on in this lesion. And that's a good sign, meaning that it's not HCC. Because if it washes out and there's no contrast in the lesion, then we would be more concerned of cancer, specifically HCC. So good job, Samantha. You want to choose the next question? And by the way, that's something I would have never known until Dr. Jawahar Anu pounded it in my head before she left us for Northwestern. So thank you, Anu, Dr. Jawahar, for that. All right, Samantha, you want to choose the next question?
Yeah, I can't. Oh, there we go. Okay. What was left in past the 5 French?
We have 300, 400, and 500.
All right, let's do past the 5 French for 300.
All right. This arterial injury or false aneurysm may occur after vascular access. Pseudoaneurysm. Good job, Talal. All right, so yin yang sign. So ultrasound, and then we have literally I think we've heard about this at least at one point, and it's the yin yang sign, and that is indicative of a pseudoaneurysm. It's often iatrogenic, and depending on the size of the neck, it could be treated with thrombin injection or manual compression. And I won't get into the details of that, but just something that you should know. All right, Talal, you want to choose the next question?
Sure. I'm feeling lucky, so I might try the 5 French for 400.
5 French for 400. All right, this condition more commonly on the left can cause infertility in the men. Varicocele, all right. Good job, Talal. Okay, so what we're seeing here is this is an angiogram and they're injecting contrast, and you can see contrast pooling in this area. And this is gonadal varices. So more often on the left side because of the angle that the left gonadal vein enters compared to the right side. If you see a varicocele on the right side, but you don't necessarily see one on the left, you want to be concerned about more serious things such as cancer. Oops, I don't know why it keeps doing that. Sorry, guys. Don't look. All right. Talal, you want to choose the next question?
Sure. I'll try passive 5 French for 500.
This necrotizing vasculitis affecting small and medium-sized vessels involves most frequently the kidneys. Polyarteritis nodosa. All right, good job. So this is polyarteritis nodosa. It's a inflammatory necrotizing vasculitis that involves small to medium-sized vessels. And the picture that you're always going to see is there a way to go back? It's always going to be the kidneys, although it could affect other areas. I had a question on my boards just a few months ago that actually showed, I don't know if I should share this, but it showed the iliac arteries. And what you're seeing is like the beaded appearance of these arteries. So good job. If you want to choose the next question.
I'm giving the points to Hari though, since he answered it first.
Oh, did he? Oh,
Yeah, but he's being a great sport. He's saying that Husa can choose the next category.
oh, you know what? Sorry. Okay, Hari, good job. Good job, all of you guys. But Hari, if you want to choose the next.
I mean, it's okay. He's looking. I already guessed one, so if he wants to pick the next thing, that's fine. Or she.
They're already working as a team here.
I know, right?
Yeah. You guys are all on fire.
You guys are way ahead of me when I was a radiology resident R1 and R2. So good job, guys.
Husa asked which ones are left. We have the 500 for nerves, the 200, 300, 400 for next generation, and the 300, 400, 500 for the doing the heavy lifting.
300 next generation. All right. May occur as a result of fall and outstretched hands. Colles fracture. Good job. I think this was a two-part question, radial head fracture. All right, so, oh, I guess the other question was, it's a buccal fracture of the distal radius. So it's a distal radius fracture. Oh, someone did say buccal. Good job, Joey Goo. So I'm gonna give that to you. But yes, what we're seeing here is this indentation along the distal radius, the metaphysis, which is in peds world we call that a buccal fracture. All right, and
Hey.
oh, sorry, not buccal fracture.
No, I'm joking. I was like, Peds world. It's the radiology world.
In radiology mode. Sorry. A buccal fracture in radiology mode. Thank you for correcting me. All right. And that was Joey. Joey, you want to choose the next question? Getting on my nerves for 500. Oops. I keep clicking the wrong one for nerves. This is a rapidly progressive cellulitis of the floor of the mouth, which can be fatal. Ludwig angina. Good job, Hari. So what we're seeing are these areas of heterogeneity. There's some enhancement or peripheral enhancement, and this is consistent with a Ludwig angina. So it's an abscess. These are serious, and if they're not caught early enough, they could lead to a lot of morbidity and mortality. So Hari, you want to choose the next question?
What's left of the 400?
We have next generation or doing the heavy lifting.
Let's do next generation.
All right. So this is a little bit of a three-part question. These are the positions of the three lines seen below. Quite a few different lines, but there's three that are actually within the patient, within this baby. All right, I'll give you guys a hint. Okay, so we have this one. We have this one. And we have this one. All right, so one of them is an NG tube. This one, and that's going into the stomach. And this is an infant, guys. So what other tubes do you have, or not tubes, but lines do you have in an infant? Okay. Melissa, do you have any hints you could give them?
Someone is on the right path with umbilical.
Yeah. Okay. Umbilical vein, umbilical artery. All right, so for the sake of time, guys, this one was a hard question, and Dr. Patel warned me about kind of making this smaller or breaking it up, but I didn't because I don't know why. But one of them is an NG tube going into the stomach. The other one is an umbilical arterial catheter, and that should terminate around the level of T6. And then the other one is the umbilical venous catheter, and that should terminate around T10, and that's in the IVC. So, when you guys become radiologists and you guys become residents, you're going to be looking at a lot of plain films, and a lot of them are going to be inpatient. Some of them are peds, some of them are going to be adults, but you always have to clear the lines first. All right, make sure the lines are going in the right place. In this case, it's an infant, but sometimes, like in adults, you'll see lines and you'll think that they're normal, but they're not. Like an NG tube that's not going to the gastric bubble, but actually just sitting up here above the diaphragm, and you okay it, you read it as normal, and they start feeding the patient, and it's actually in the lung. So What issue does this infant have? I am not sure. There's potentially a male rotation because we're only seeing small bowel on this side. Could also just be a infant that was born prematurely, so a newborn in the ICU. But cannot tell you that, and that was not part of the question, so don't question me, guys. All right, next question. I think I'm gonna give that to, who said NG tube first? Pizza. You want to go ahead and choose the next one? Oh no, it's okay. It's a question I should have asked myself. What what is a patient here for? All right, 400, heavy lifting. These H-shaped vertebral bodies are classically seen in this disease. All right, sickle cell. Yes, you are right, Joey. So sickle cell disease. So these H-shaped vertebra, these don't look normal, right? Like they're indented on the superior and inferior end plate, and these are classic for sickle cell. It's not quite ankylosing spondylitis, because ankylosing spondylitis, you're going to see flowing calcifications along the vertebral bodies and most often along the anterior. All right, so Joey, which questions do we have left, Melissa?
We have 200 for next generation, 300 for heavy lifting, and also the 500 heavy lifting.
All right, great. Joey, which question do you want? MSK for 500. This is a pertinent pathology on this sagittal MRI of the knee. Meniscal tear, okay. A torn meniscus. I think I'm gonna have to give that to Joey. Sorry, Connie, because he, well, no, wait, no, I think I'm gonna give that to Connie. It's the same thing. You guys are saying the same thing. But I guess the answer I'm looking for is what horn? It's gonna be a posterior horn tear. And sorry, Joey, I thought yours said horn tear. But that goes to Connie. It's a posterior meniscal horn tear, and this is what we're looking at, this hyperintensity seen here. So Connie, with all the smiley faces and frowning faces, you still won it. So which question would you like? Heavy lifting 200. What arrows point to this sign, seen in aggressive bony lesion? Oh, we already did this one. Kaufman triangle. Good job, guys. You guys still remembered. Melissa, which ones do we have left?
The only one left we have is heavy lifting for 300.
Heavy lifting 300. All right, Connie, that's the one that you're going to choose. This soft tissue sign, suggestive frac. Wait, we already did this one too.
Do you just want to go through all the MSK questions and see if there's another one we haven't answered?
Sure. Sorry, guys. I think we answered all of them actually. Yeah.
Joey is recommending us to check innards for 200.
We've done that one. Do you guys remember it? Small bowel obstruction. All right, I think we did all of them, guys. Innards for 300. Oh, you're right.
Ooh, okay.
Hey, good job, Trisha. You're keeping better track than 2 radiology residents. This fat-containing lesion arising from the right kidney may be associated with this phakomatosis. AML. Good job, guys. So yes, we are seeing an angiomyolipoma. Oops. Which is associated with tuberous sclerosis. And what we're seeing is this lesion right here, and the low density, very low density, almost compared to fat. I mean, it is compared to fat, is what tells us that this is AML, which is a benign lesion, but we do want to treat it once it gets to be bigger than a certain size. And usually that's 4 centimeters, and the risk is because of bleeding, increased risk of bleeding. All right. I think time-wise, we are running out of time, so I want to tally up the points, but I don't, Melissa, do you have the points all tallied up?
We actually still have Final Jeopardy, right?
Yeah.
But I can read out the points so far. We
Okay.
have Mir in the lead with 1,200 points, Hari with 1,100 points. We have Hifsa with 500, and Samantha with 700, Smriti with 100, Maria with 200, Louisa with 200, Joigu with 1,000, Ilili with 400, Shizia with 400, Talal with 700, Connie with 500, and Shiva with 300.
All right, awesome. You guys are all rocking it. I was gonna say you guys should wager your points, but I think we only have 2 minutes. So how about you guys internally wager points, and then we'll do this final Jeopardy question, okay? So so the final Jeopardy question is going to be in nuclear medicine, which now is our responsibility as radiologists. 80-year-old man with remote history of cardiac device placement presents to his PCP with bilateral hip pain after fall a week ago. What is the likely diagnosis? All right, compression fracture, sacral insufficiency fracture. That's the best answer. That actually is the correct answer. So we're seeing a sacral insufficiency fracture, and the sign that we're seeing is called the Honda sign, because it literally looks like a Honda sign, but it is an actual radiologic sign that we like to describe. So good job, Louisa. Good job, everyone. By the way, the Honda sign, we see it on these bone scans specifically. And you guys will all see this in nuclear medicine because you guys all have to get 4 months of it when you're in radiology. And it's great. It's a great addition. So good job, everyone. Honestly, you guys all did a really good job. Even the ones that were, quiet, I know you guys all know some of the answers. You guys are probably like me, were a little bit hesitant or just slow typers, but everyone, really good job. And good luck with everything. Good luck with your road ahead. And if you guys have any questions, please reach out to any of us, and I'd love to answer any questions.
Hi, everyone. This is Maria Bashir. I just wanted to say thank you to Allah and to Melissa for hosting this and representing Loyola, and to Dr. Rucha Patel from Advocate Christ for helping out with this as well. Thanks all. We'll turn it over to the next group.